Okay, so the use of ART, according to the Italian Ministry of Health, the use of ART remains relatively uncommon compared to the potential demand. However, there has been a large increase in ART-related deliveries in Italy in the past 10 years of 73%, and in 2022, ART represented 3.7% of all deliveries, up from 1.8% 10 years before. And so despite this increase in utilization in ART, we know very little about Italians' attitudes towards these technologies and ART norms in ART in general. And so in this study, we aim to answer these questions using a factorial survey experiment, which is an experimental design which consists in presenting individuals with some scenarios called vignettes with different characteristics regarding a hypothetical couple and to ask them what the couple should do with respect to the eventual use of ART to achieve their fertility goals. And then by studying variations in people's responses and how they relate to the characteristics of the couple presented in the vignette, we can try and understand what are their attitudes towards ART. So the data for this study were collected using an online survey, which was conducted in Italy between July and October 2024. We interviewed a bit less than 5,000 individuals who were in a heterosexual union, either married, cohabiting, or living apart together, aged 25 to 49. And we used a quota sampling strategy. So we imposed 5 years age classes, sex, region of residence, and education by sex, so that we made sure that the sample that we got reflected national demographics. In the vignette, we manipulated 6 dimensions. So 3 dimensions relate to the couple situation, and they include the woman's age group, whether the couple was childless or already had a child, and the time spent attempting conception, 1, 2, or 3 years. And then the other 3 dimensions relate to the ART treatment itself, and they are the cost of treatment, which could be provided either free of charge, so covered by public funding, or for €3,000, which is the average cost of an ART treatment in Italy, source of gametes belonging to the couple or coming from a donor, and proximity to the fertility center, which could be in the region of residence of the couple, outside of the region but still in Italy, or abroad. So here you can see all the dimensions and levels that we used, and the combinations of all these characteristics gives us 432 different vignettes, and these correspond to the vignettes universe. Here you can see an example of one of these 432 vignettes, which we presented to respondents. So we start with the description of this hypothetical couple called Caterina and Tommaso, which are 2 typical Italian names. And we describe the characteristics of these couples, according to these 6 dimensions, and then we ask them 2 questions. Should Caterina and Tommaso use ART? And answers range from 0, very unlikely, to 10, very likely. And then what should Caterina and Tommaso do? And the range of answers were from initiating ART treatment without delay to abandoning their plan of having a child. Okay, so each respondent answered 6 vignettes, so we had around 66 observations for each one of the 432 possible vignettes. We used both random effects and fixed effects models. The results were virtually identical, so then we focused on the random effects, which is the most efficient one. So I'm skipping these tables because of time. I'm just going directly to the summary of our results, which is the most interesting part anyway. So the personal characteristics of the couple, like the woman's age, parity, and especially the time spent conceiving, were the most significant factors influencing attitudes towards ART. Cost was also important, while being close to a fertility center didn't seem to have much relevance. Very important was the type of ART treatment used. So overall, methods that replicate traditional family structures by enabling couples to have biologically related children were seen much more favorably than methods that use gametes from a third party. However, if the couple was childless, then attitudes towards ART became much more favorable also towards these alternative treatments. And this is a notable result in a country like Italy, which is often considered very traditional. Thank you.